I had two hand injuries that required surgery in college, and it helped me appreciate how much we do use our hands, whether it's just gesticulating to talk or everything you do day to day. I would say that I'd taken sort of that function for granted, and I started to recognize how debilitating it could be. The intricacies of things that patients can run into while they're getting better helped me really drive an interest into treating hands long term. My name is Stephen Liu, and I'm an orthopedic surgeon here at Penn Medicine. In terms of the hand, wrist, and the elbow, I treat basically anything that involves that part of the body that could potentially involve surgery. That could be something as simple as someone coming with a bruise, a bone bruise, a muscle bruise, something where they think they may have a break of the bone. They can be tendonitis. You can have cut tendons, nerves, arteries. It could be arthritic changes, so arthritis of the hand, wrist, and elbow. And then, some of the significant ones that are more acute are folks that have industrial accidents. My practice is split between the inner city and the suburb. There's about 40 miles of distance between Philadelphia and Westchester. In terms of my patient population, I see everybody. I'm lucky because it allows me to sort of take similar issues, right, in a broad variety of people and find ways to treat them so that it works best for that person. There are other things in which you manage in terms of how somebody does after surgery, how you're going to help them, whether it's with therapy, whether they're going to rehab on their own, how often you're going to see them, what sort of resources you need to help them have to help them succeed. It's such a personal thing when you interact with folks and I sit with you, I'm looking you in the eye, and then I'm looking at your hands, right? I get to hold your hand literally through the treatment because that's how I'm going to examine you. That's how I'm going to see if things are working after your surgery. And so it's a very close personal relationship to be able to take care of someone's hands.